don't want to be the expert on them, their body, their baby. I'm not an expert on anybody, I know a lot, but they're their own expert. And if you continue to take power away and be the expert, then they'll continue to feel like, it has to be the preschool teacher or the doctor or someone external that will tell them what to do instead of them really gaining confidence. They've learned the language of their baby. Yeah.
And themselves, right? To trust themselves.
Trust themselves, yeah.
Today's Into Healing guest is Laura Erickson, a certified and licensed professional midwife and the director and owner of Alma Midwifery, a revered birth center in Portland, Oregon. This is Into Healing, and I'm your host, Mira Kaddoura.
Laura, I'm so honored to be sitting with you. I found you when I was pretty late into my pregnancy, and you were just such a steady presence in my labor, and I feel so grateful to be sitting with you. I still remember when my daughter's head started to come out, and you were like, you can catch her, reach down and catch her. And it was just such an incredible, moving experience for me that I always say I wish I could bottle that and give it to everyone. So thank you for having been there and supported me through that.
Oh, well, it was definitely my honor to be there that day, and I'm honored that you called me up and asked me to do the show with you, too.
Thank you.
I'm happy to be here.
I'd love to start by you just telling us what midwifery is and then how you got into it.
Sure, yeah. So midwifery is the art of helping babies be born, and it's ancient. A lot of the Bible and a lot of old texts and Shakespeare, bring up midwifery, and it probably started just in, villages where there was a wise woman. That's one of the terms for midwifery. Not that I'm so wise, but...
You are very wise.
And it was a person who was just knowledgeable on how to safely bring babies into the world. And, the art and craft of midwifery over the years has, of course, changed so much. But all over the world, most babies are still born into the hands of midwives. Obstetrics is new in the last 150, 200 years, but midwifery is like the older model. But it's changed in that we're more of a blend now of medicine and some of the older arts of midwifery. And my goal is always to kind of meet in the middle and have that sweet spot where, of course, we would give antibiotics if necessary and can treat a hemorrhage with the same medications found in most hospital settings. But at the same time, we want to really connect with a person giving birth and know that she's way more than, just a uterus and contractions. She's a whole person having a whole experience. So the art of midwifery just means with women. That's what the definition of midwifery is. Yeah. What midwives do now in the United States is we do all of the prenatal care, attend the births, and then we also do postpartum visits for the person who gave birth, and also well baby visits. And 2 of those visits are in the home, so our home visits are a lot of fun.
Yeah, I remember mine.
Yeah, they're fun for us. Maybe the babies are, a little cranky before the milk comes in, or maybe there's lots of boo-hoos on day 3, but it's a really important part of what we do is being able to go into the homes, and it reduces postpartum depression. It enhances the success of breastfeeding. Most of the people we serve choose to breastfeed, and so we're big advocates for, making sure that breastfeeding is as comfortable as possible. And so when we do the home visits, it really reduces some of the poor outcomes that can happen in those early postpartum days because we're keeping eyeballs on them.
Yeah, and I'm sure it's because the woman also, the person birthing feels supported, right? You don't just feel like you birthed, and then where is everybody, right?
Yeah. And so when we do those home visits, we're not just, checking vital signs and weighing the baby. We're just sitting with her and maybe even processing the birth experience that, such a monumental experience that she went through, and, listening to how the rest of the family is adjusting. And I think it just is such a luxury in our business that we have the time to really spend with people. So the average prenatal appointment for a hospital-based provider is about 7 to 15 minutes where the pregnant person is actually with the provider. And I know a lot of my friends who work in hospitals kind of anguish over that. They want to spend more time getting to know people, but their schedule is so brisk.
Yeah.
And the whole, insurance industry is really forcing a faster and faster clip for the amount of time that they're able to spend with people. So we spend about 45 minutes to an hour at each prenatal visit, and that allows us to really get to know people and to know their desires for their birth experience. It also gives us time to do informed consent for all the procedures that we can offer. Instead of just giving someone a lab slip and saying, go down the hall and have this test done, we try to anticipate about a month before what tests are coming up for people so that we can talk to them and say, well, you are 24 weeks now. In about 4 weeks, we recommend that you have a gestational diabetes screening. And then we take the time to explain what that is and give them written information, because everybody learns differently, what gestational diabetes is and what their individual risk factors are. And then another month goes by and they're familiar with what it is and know what to expect.
Yeah.
Yeah, so a lot of informed consent and education is just built into every prenatal visit that we do.
Yeah, it's amazing. I feel like we lived in these more village-like environments, right? We had a lot of the wisdom keepers around us. We learned from them, and now we've been separated from so much of that. So having those resources, having, other women that can be next to us during this process is so huge. Mm-hmm. How did you get into this field?
Well, I was born to two educators. There wasn't any midwifery or even medicine in my direct family. My dad was a principal, and my mom was an English teacher. And so it was kind of bizarre that by the time I was 10 or 11 years old, I just had this fascination with birth. And it didn't even have to be human birth. I went to a friend's house and she had a pregnant poodle. And I'm a little kid and I'm over there feeling all these little puppy heads inside of this poodle. And, if one of our neighbors was pregnant, I just couldn't keep my eyes off her belly. And it just seemed like such a magic trick. That,
It is a magic
trick. It is a magic trick,
magic
that we're all sitting in this room now and it's very quiet, but if someone was giving birth, of course, she'd be making her birth noises. But, the next moment, there'd be a whole other voice in the room, the baby crying. And that just seemed, it is just so incredible. And I've been attending births for about 40 years, if I include my time as a student. And I'm still fascinated.
That's so cool.
And I attended a birth before I arrived here, or a postpartum part of the journey for this person. So here I am, a little kid palpating poodles and babysitting for free because I was just interested in newborns and too. So just an early fascination. And then when I was 16, I had the opportunity to go to Europe to visit a friend, and her dad was an anesthesiologist working in a military hospital in Frankfurt, Germany. And I asked if I could go along with him if there was a birth.
Oh, wow.
And he said yes. So I'm a teenager at 16, and I got to go to 4 births, and they were all surgical births. So the first 4 births I ever attended were all C-sections. And that was fascinating too. There's this mom, and then all of a sudden there's a baby. So from 16 to 20, I didn't attend any births. I was working on my education. And then I was in midwifery school and started to attend births at the age of 20.
Oh, wow.
All home births in Austin, Texas,
Oh, wow.
with Mary Michael Penn. Shout out to her. She just wrote a book.
So tell us a little bit about the education that what midwives, do. What does that education look like?
In the States, there's 3 tracks to midwifery. The route that is now most common is that a person gets their bachelor's degree in nursing first, and then does a master's program in midwifery and is a certified nurse midwife. I didn't choose that route. I started in nursing school, but didn't have an interest in illness and pathology. And it seemed like, when I was 20 years old, it seemed like too long to wait to go to births. I really wanted to go to births because in that track you do your nursing, and then, so it might be 5 years before you actually start attending births. I was a little bit worried I wouldn't like midwifery. And I knew I didn't like nursing. So I just felt like I didn't want to wait that long to go to birth. So I moved to Texas and started a midwifery program down there. It was a traditional midwifery program. And I started the program in January, and in March I started attending births.
Wow.
So it was March in 1984. So that birth was an outdoor birth in Texas.
Wow. In Austin.
There's
a lot of that in Austin.
It was a little hippy dippy time, and the only complication of her birth is that she got a little sunburned on her legs. The mom did. And I left that birth. I turned on the radio, and the song "It's All Too Beautiful" was playing, and I just cried. And I'm like, I do like birth. I can do this. It was kind of a love at first sight. And so I did an apprenticeship with Mary Michael Penn down in Austin and other midwives. And just I learned through the apprenticeship route and through a midwifery certification program.
So just by practicing and being around other midwives and learning from them.
Yeah, and then I eventually became a certified professional midwife. So I'm a CPM. And then the third track that's recognized in many states is naturopathic doctors who become midwives. And there's several here in Portland who practice midwifery too.
So they do the naturopathic degree, and then they do certification in midwifery?
Naturopathic doctors, and then they're midwives.
So interesting.
Yeah. So I work and own a birth center in Portland that has a blend of 3 certified nurse midwives and 2 certified professional midwives.
How many babies have you ushered into the world?
Well, I've ushered in 4. And that's because I've given birth 4 times myself. So only people who have given birth can, say that. But I understand your question. I've attended a couple of thousand births. I honestly lost track. And now a lot of times when I do a birth, I might be in the room kind of assisting and helping. But yeah, it's still very special each time.
That's cool. And then I know you had mentioned just before we start that you also have relationships with doctors. How does that whole thing work too?
They're built over years. I think we're living in a pocket of the country that acknowledges and recognizes midwifery. I know it's not the same in other places. Midwifery has been illegal in some states and perhaps still is. But here we are able to transport into the hospital if we need to. A transport is when you start a birth in one setting and then, because of certain risk factors, go into the hospital. And our transports aren't usually urgent. That's part of building relationships with physicians, is they know that when we come in, that we won't bring someone who, it's like usually is not urgent. So we've met several physicians through the hospitals here, and because they know of our practice and know that we're safe, careful, confident midwives, competent midwives, we can even just text them sometimes or call them, and they're willing to meet us at the hospital, or just do a consultation if we're kind of sitting on the fence with something.
Yeah, and when you say that they're not urgent, what do you mean by that? Like,
So an urgent transport is less than 1% of our, when we looked at our statistics. So an urgent transport would be something that we didn't have a lot of warning towards, and it kind of came out of nowhere. Because even though I love midwifery, I don't like adrenaline, and it's never, it's can be stressful for the person who just gave birth or is in labor to all of a sudden switch settings. So that would be an emergency where we'd have to call 911 and get an ambulance and transport to the hospital. So most of the transports are, they go in their car and we go in our car. We go to the hospital, we give them the report. So they're not an emergency.
not an emergency. And how do you make that decision? And what are the different things that come up that make you decide to, change course?
So we're using risk scoring all the way through. So that means someone calls the birth center and they're like, "Hi, I really want to have a birth at your birth center," and the front desk person, the receptionist, knows to ask them some questions. So if they call and they say, "I've had 2 cesareans and I really want to have a water birth," we have to have a gentle way to tell them that they are too high risk for our setting. So the risk scoring is like a whole list of things that make a person not a candidate, so we would not even start that first appointment with them.
Interesting.
Other
So
risk
C-sections
factors
make you higher risk to have
if you've
a
had
vaginal
2 or more C-sections. One C-section, there is risk of a complication during birth. So at my birth center, we don't do vaginal births after cesareans, but a lot of sites do, and we used to, but it's more of a malpractice. The malpractice is getting higher and higher, and if you do VBACs in your site, they're even higher. So for us, it would be, if someone has diabetes, type 1 diabetes, or if they're having twins. And so throughout their pregnancy, we're continuing with that risk scoring. I was doing it with you, but you didn't even know it. Because what makes a birthing center a safe site is that someone is low risk. And most people are.
Yeah.
Yeah. So the risk scoring goes all the way through. And so that happens during the birth process too. So our number 1 transport is for non-progression of labor. And that's usually a first-time mom. We're super patient. We believe in the tincture of time, waiting and waiting. We're really good at waiting.
You waited a long time with me.
We're going to be willing to wait. And while we're waiting, we're making sure that mom and baby are safe, making sure that the heartbeat is normal and that her vital signs are normal and that there isn't, any infection or any other complications that would make us not want to wait any longer.
I still remember you saying a couple times when Mila got stuck at 8 centimeters, you kept on repeating, there is no shame in going to the hospital. At any point, if you want to change course, let me know. I'm here, And I'm like, nope, I got this.
So that's an example of the way we work with people in that we're not like the big decision makers of what happens. Of course, if there's a complication, we're not going to sit and talk about pros and cons and get your consent, like, "Oh, I think your baby needs to be resuscitated. Here's the pros and cons." We're going to go for it. But whenever there is an opportunity that's safe, we would give, pros and cons of staying home or, giving people choices all the time. And that even goes down to, I wouldn't even just put a blood pressure cuff on you and check your blood pressure. I'd say, "Is it okay if I get your blood pressure?"
Yeah, I remember.
And you might say, "Just give me a minute."
Yeah, I remember how much you took care. Like that's, when you there's so many details that fall away, but then I remember how much you took care of me, and it that's what stays in the end.
Yeah, most midwives are pretty nurturing, so we provide a lot of high touch too if people are receptive. Massaging backs during prenatal care. Sometimes I do more of that than the rest of my group. So massaging back support in labor, and then just helping the partner. You might say, hey, go ahead and push on her back right here, or, help her to squat in this position.
Mm-hmm. Yeah, I remember you massaged me a lot. I remember there's a funny incident. I remember I got to a point where I was really in excruciating pain, and I remember saying to my partner, saying oh my God, I'm going to die. And he just looked at me and he goes, not today, honey.
Yeah.
And then you were just there and, helping me move through all of that. And,
giving birth is a little bit of a death. I mean, they say that's the orgasm, right? It's a tiny death or whatever, but it's really that first birth especially is a death of the maiden. You're never the same once you're a parent.
100%.
And so there is that feeling of, I think I'm going to die in labor. And we're there to look you in the eye and say, no, you're not dying. This is normal. You're okay. And even if it's not the sensations that make you believe that, there's never a bigger shift in a person's life than the first birth.
I get goosebumps.
Yeah.
You're a whole different person.
And it's for both partners, the other parent, if there is another parent, they're also going through that. So part of our job as midwives is we don't ignore the partner. In fact, most of the time the partner will catch the baby. And we train them. We teach them how to do that. And it's just an option. They don't all want to do that, but we teach them how to reach down and receive the baby, and then the baby just goes right up onto the chest. The baby's not going to be whisked away or anything. The baby just lands right here.
Yeah, it's so beautiful.
And that moment belongs to the family. That doesn't belong to anybody else. That's a profoundly private, beautiful moment.
You just covered, who midwifery's for, and just the risks that you kind of evaluate before somebody comes into your practice. What questions should one ask themselves when considering midwifery, as an option?
Yeah, so the basic question they need to ask themselves is, are they interested in unmedicated birth? It takes a lot of preparation to give birth unmedicated, especially when in the back of your mind you're like, oh, about 4 miles from here I could go get an epidural, I have worked with populations who knew that they would never go to the hospital, and so they didn't have that little off-ramp. Like the Mennonite population I worked with in Minnesota, they just would never go to the hospital. They would if there was a risk, but because they had watched their, sisters or aunties give birth, or maybe their mom, that was just kind of what was deep into their subconscious. But working with people now, most of them know that they could get an epidural. So they have to really prepare through childbirth education, meditation, just visualization, all the things. That would be a whole separate interview. But so they have to be willing to do the birth to really prepare for natural childbirth.
Yeah.
So that would be their number one question. And reproductive rights includes, the right to birth the way that you want to birth. And I have zero judgment for people who want to have a hospital birth and want the epidural. I just want people to think about it, to know that there is another option. So looking at, are they willing to give birth without an epidural? Are they, is it within their philosophy to, not want all the interventions in the hospital? There has to be a certain ownership, which is what you took in that moment where I said, you're not going to win a prize or whatever, for hanging out at 8 centimeters. So, knowing that when they are at the birth center, there won't be an epidural. And then the benefit, of course, to them is that they aren't attached to a lot of things. So I don't know if this segues into the same topic, but in the hospital, if you receive an epidural, there's, the epidural in your back, which is starts as a needle, but then is a tube, a blood pressure cuff that comes and goes, a little pulse oximeter on the finger, often a urinary catheter, an IV, a band for listening to the baby's heartbeat, and a band to measure the ultrasound or to measure the contractions. So that ends up being a little bit of a puppet show. And so during that hospital birth, that person is navigating all of these things that they're hooked up to. So they lose the ability to go from hands and knees to into the water, to squatting, to standing in the shower, So there's, yes, you have complete pain relief, but you also are pretty tethered to a lot of things. So it all, when we first meet someone, we have a pretty in-depth discussion, not only about risk factors, but about what their desires are. And just, we really want people to know
Yeah, I think that's
what this is.
Exactly. And I think a lot of people just don't know what their options are, unfortunately,
Yeah.
So they kind of get taken or get kind of gobbled up by whatever is the dominant narrative,
Yeah, just even though birth centers are growing, there's still just very few people in the U.S. who choose birth centers. And it's really common for me to run into someone, or maybe there's a sister at the birth who watches, her sister give birth, and then afterwards she's like, oh, I wish I would have known about this. I wish I would have done this. So, and most people, once they have experienced a birth in a birthing center or a home birth, they will continue to have other babies in the same way. It'd be very unusual to have a home birth and then go back to the hospital.
Yeah, like I felt, because obviously I had my third at home, I felt so safe, because it's like you're at home, and there's nothing that feels safer than that.
Yeah. So we attend home births and birth center births, and the benefit of a home birth is, here me and you are sitting, a little more upright in chairs, and once you get home, of course the bra comes off, or
you're just comfortable.
I'd probably be, this would probably be me at home. There's just that comfort to being at home, and as far as the microbes, if you go to the hospital, it's the sickest people in town are at the hospital, even though the labor and delivery is usually in a different part of the hospital. And in the birth center, of course, we keep things very clean, and we sanitize the tub and all of our instruments. It's still kind of a public place, but in your home, it's just your own germs, in your environment. And so it is safer that way. The nosocomial diseases or sicknesses that you can pick up in a setting are very much reduced in the out-of-hospital births.
So what are some of the misconceptions that people have about midwifery?
Yeah, there is...
Like, why isn't it more widespread?
Yeah, there's a statistician, and luckily for us, she's in Portland, and she's also a midwife. So she's a CPM like me, and she's a statistician who teaches at OHSU. Her name is Melissa Shaney. And so she did some research interviewing hospital-based practitioners, usually OBs. Maybe, I think there might have been nurses involved. But in that study, there were so many misconceptions about the work that we do. And that's just with medical providers, that it's risky, that it's dangerous, that we take things too far at home. But the statistics about what we do don't back that up. I mean, we have very low incidence of poor outcome. It's comparable to the hospital when you compare healthy like populations. So it is a misconception. I just think that most, pregnant and birthing people just don't know that it's an option. They don't, unless a lot of times you know someone who's done it and then you do it. It's a lot of word of mouth.
Like I remember after I gave birth to Mila and I was telling somebody about, having a water birth at home, I got, some reactions that were quite like, why would you do that? And why would you risk, your baby's life? And I was like, it was the furthest thing away. My experience was the furthest thing away from feeling like I was risking. I actually felt like I was doing exactly what I needed to do.
Yeah. Well, you're talking to a midwife, so I agree.
Yeah. But it's so interesting how there's so much fear around, we live in cultures of fear that scare us into doing certain things, especially I think as women, Yeah.
Yeah, we've taken, birth and death out of the home. I think we're very afraid of death in our culture, even though it's just as natural as birth is, in many instances. But it is sanitized. A lot of people who are terminally ill, may opt to die at home in hospice, and that feels a lot like a home birth. There's a lot of similar elements. I've had the opportunity to do, to sit with some elders who are dying too, and the elements are so similar, but we're also spooked of both the coming into the world and the going out of the world. And birth is really nothing to fear. It's as far as the things that our bodies do living in the United States, it's one of the most dramatic things we do. We don't, I didn't carry a jug of water on my head for 3 kilometers this morning and then squat and make a fire, So we don't even live in our body the way our ancestors or sisters around other places on the globe
world,
do. Yeah. We sit in our cars and we sit at our desks and we can take a shower a day, and so we live very easy lives compared to historically. So birth is
it feels very dramatic.
a really
It's a big
dramatic,
thing,
big deal for our bodies to do something.
Even though it's one of the most natural things and has been done forever and ever and ever.
So I remind people of that throughout their care. That when they're still pregnant, just, abandon the chairs and sit on the floor a little bit and get down into a squat and walk 1 hour a day per 24, because our bodies are meant to be in motion.
Yeah.
And the sitting is really hard for pregnant people.
Yeah, I remember even with my first twin birth, I remember I constantly had that, like, my mom did this, my grandmother did this, like really tapping into that wisdom of all the women that came before me that did this, and just going like, I got this, and just like tapping into that power and into that wisdom.
I'm so glad that you remembered that and had that, just like, and has everyone in your family given birth vaginally? If it's your
Backwards?
mom, if it's
my
your
mom,
and
my grandma.
if it's your mom and your grandma, then probably great grandma didn't have that opportunity.
Yeah, they all. I think my grandmother gave birth to my mom at home, but then my mom gave birth in a hospital, and then, things started changing in the last say,
and I
50 to
am
70 years.
100% not anti-hospital in any stretch of imagination, because, of course, it's life-saving. But now our C-section rate, cesarean birth rate, has gotten so high. It's up to 28 to 30%. And because of that, a lot of people who I'm serving now were born by cesarean.
Interesting.
And so I won't even, talk about what I think the links might be to that. But then if their mother is at the birth, they don't have what you just described, because maybe their mom and maybe even their grandma now was born surgically. So this is this young woman now trying to do something that hasn't been done for a few generations.
Yeah, that's so interesting. Yeah, with my first birth, which was a twin birth, I had the picture of my grandma next to me because I was like, I'm tapping into that power.
Yeah, absolutely.
What about midwifery is special? Like, what makes it sacred and what makes it special?
I think just the attention to the sacred. Everything can be sacred, right? You could sacredly make a sandwich if you want to. But I think it's brought to the birth of course, by the person giving birth, and she gets to decide what's sacred to her. And the picture of your grandma next to you probably felt sacred, or people of different faiths might bring different objects to their birth that give them strength, and so their experience will be really hinging on what their spiritual practices are, if they have a spiritual practice. I'm always happy when they do, though, because it helps. I don't care what it is, just having some belief in God or higher power or nature or science or whatever, because you do need to be able to tap into something.
Bigger than you.
Yeah, that does help. But I know what it is for me. The sacred for me is ritual. I always sing the same songs on my way to births in the car, and I won't grace anybody with that. But I've sung the same song every time I've gone to a birth since I started attending births. There's just the ritual of setting up our equipment in a certain way. Just because what we're doing is exactly what midwives have done forever, just sitting by someone, looking into their eyes, pushing on their back, give them sips of water. That's something that we've all been doing forever. And to me, that feels sacred because we've lost a lot of that. We're zapping our food in the microwave. We've gotten away from things that are identical to what people have always done.
You saying that makes me think we've gotten away from things that feel nurturing. For convenience, for, efficiency.
That's one of, a question I love to ask people is, think of a time that you were doing something that could have been happening on this planet, hundreds or 1,000 years ago. One of mine is I have 4 kids, had them all at home, but I remember having my daughter on my hip, and she was maybe a year, 11 months, and I was picking raspberries, and I was putting those raspberries in her big fat lips, and she was eating the raspberries, and I thought, oh, I'm like a hunter and gatherer, and so that can feel sacred. So one of the reasons midwifery is sacred is because we can bring that into the room, because we have time to bring that into the room, and to help people to remember. Sometimes after a birth, people are so tied up in the physicality of what just happened that I like to help ground them. And sometimes, like I said, I just was with a postpartum family this morning, and the baby had little fuzzy cheeks. And so the mom was kind of frazzled, and I just drew attention to, look at that little fuzz on your baby's cheeks, and he's kind of got some sideburns, and just, you can bring that sacred grounding knowledge to people just by pointing out just like the perfection of their baby's little faces. And
it's beautiful. How is midwifery a healing practice?
Well, as I was preparing to come to your show, I was thinking how it is healing for the people giving birth and for families. And I think that's really easy to answer. But you can midwife anything into being, right? Because you were telling me on the phone that you had this idea for the show, and it was just kind of bubbling up in you. It was kind of niggling you, and it was almost as if you couldn't do it. And so you midwifed this into being for yourself. And, people might have an idea for a book or a career change, or, you can bring forth anything through some of the values of midwifery. And so that would be really listening, number one, listening to that. And then midwifery is usually a very gentle art. So instead of forcing something into being, you kind of can gentle something into being. And that is profoundly healing, to allow yourself that, because it can be a slower pace, It doesn't have to be precipitous. How midwifery can be healing for the people that receive care from us is it can be distinctly different. People have different relationships with their bodies and the times that they've needed medical care, and sometimes it could have been frightening for them, especially as a child, or so we work with transgendered people who have had really difficult interactions with some medical people, but when they come to our care, they're listened to, like truly listened to, given choices, and also, their way of being is embraced, and that can be, like their diet, or special things that they want during their care or their birth that are unique to them. So we're trauma-informed providers, and 1 in 3 people have had a sexual abuse history, and so we understand how to provide really gentle care for people who have had trauma to their bodies.
Yeah. I get goosebumps as you say that.
A lot of times after the birth, people believe that something in them has healed through that process. I know the word empowered is way overused, but people will feel empowered.
Yeah, because you get your power back.
Get their power back.
Yeah. What do you enjoy most about being a midwife?
So many things, but I love that moment, that I described, that moment of birth where here comes the baby and it's up on her chest, and the person who just gave birth is, oh, I did it, or, the partner be like, oh, it looks like your dad, or, there's always a combination of celebration and I did it, and oh my God, I'm glad it's done, and it's a really high moment. So it is that moment.
Or like me, I just cried.
I love.
I was so overwhelmed with like all my emotions.
A lot of people will cry, and so that's a tasty moment. I do love that.
Yeah, what a gift to be able to see that every day.
Yeah, a couple times a week usually, but it's that's an easy answer to why I love midwifery, but I love the rhythm of it. Meeting someone when they're maybe a little nauseated and early pregnant, giving them herbal ideas and lots of ideas on how to deal with that. And then seeing them from early pregnancy, they're growing a big belly, they're miserable, they want to be done, through the birth, and then to the postpartum. And then our final visit with people is the 6-week visit. And by then, this baby's smiling. So you go from, hearing that heartbeat at the beginning of care all the way to seeing this maybe, 10 to 12 pound smiling baby. And parents by 6 weeks are usually feeling sturdy and confident. And part of what we do is to try to help them feel confident. If someone asks me a question, my baby has gas, what should I do? I'm like, well, what do you think? Because I don't want to be the expert on them, their body, their baby. I'm not an expert on anybody. I know a lot, but they're their own expert. And if you continue to take power away and be the expert, then they'll continue to feel like, it has to be the preschool teacher or the doctor or someone external that will tell them what to do instead of them really gaining confidence. Like, oh, when my baby makes that noise, I know what it means. They've learned the language of their baby. Yeah.
And themselves, right? To trust themselves.
Trust themselves, yeah.
What does women's health care need more of?
My quick answer is perimenopausal support. Yeah, that's a big void. That is kind of one of my next projects, is to bring that to Alma. I believe that menopause is kind of also a taboo. People don't want to talk about it, and I think people need a lot.
I'm going to be calling you soon when I go through that.
Yeah, we have a certified nurse midwife who's very interested in starting a perimenopausal practice because it's such a need. And I just think more midwifery, more people knowing that this is available, and that in women's healthcare, just overall bringing some of the elements that I talked about, that you can bring the listening, you can bring choice, giving options, giving people autonomy, but guiding them. Yeah.
Do you have any hopes for this beautiful practice? Like, if you can envision anything, what would it be?
I just would like more people to know that it's a safe option. I think that's my biggest hope for the people that we serve, to know that it even exists and it's out there. I mean, I've had people say, "Oh, you're a midwife? Is that like a wet nurse? Oh, you're a midwife."
They don't know.
You're a midwife? Are you a doula? There's still a lot of people really don't know. So I would like more people to know that this is a choice. And I also want parity for payment for us. We work so hard, and we give such great care, and we have wonderful outcomes, and we're paid miserably by insurance companies.
Oh, wow.
Yeah, we're paid at
Why
about
is that?
65 to 75% less for doing the exact same thing.
Wow.
And so I belong with an organization called the Association of Oregon Birth Centers, and we're really working hard on parity.
Wow. Why is that?
Why do I think it is?
Why do you think it is? Why?
Do you know why I think it is? I think it's because we're midwives. We've got the word wife in our name.
Oh my God.
And you don't have to pay wives for anything, right?
Oh my God.
That's my secret thought. Now it's not so secret. Midwives in the United States and in Europe were actually seen as witches, 100 years ago, and burned at the stake, and
Because of the patriarchy, though.
Because of the patriarchy,
Instead of these magical beings that had six senses and everything else.
Yeah. And I mean, there's a lot more that goes into that. They were also, giving people herbs and helping women to have less pain in birth. And so through, in Christianity, in the Bible, women should have pain with birth. So that's part of why midwives were seen as witches. So it goes way back to that history. And the United States also pretty much wiped out midwifery, where Europe has continued to use midwives. And
I mean, in the Netherlands, most births happen at home.
Yeah, so because midwifery was wiped out in the United States, we had to kind of make this resurgence. So Ina May Gaskin, the author of Spiritual Midwifery, and worked on a big commune and brought midwifery, a little bit more into our, consciousness, and it's slowly grown since then. But there's just a lot of misunderstanding about what midwives do and who we are. And so, there goes the insurance companies too. So to not pay us seems, seems like an okay option, but it isn't.
Do you ever get any kind of rational explanation of why that is?
The excuses have been, well, you just work with low-risk women. I have a whole list of them. I don't think I can pull them up in my brain right now, but there's a list of reasons. Or you're just midwives, or
Wow.
So we're actively working on that. Because, we have malpractice insurance, we have overhead, all of our tools and medicines are, expensive and getting more expensive. We have continued education, and the midwives who will work in birth centers, if they're certified nurse midwives, can make 30 to 40% more if they work in the hospital. So the midwives that work in my birth center, in birth centers, do it because they're passionate, because they love what they're doing.
And they don't want to be in a hospital
And they
setting.
don't want to be in the hospital setting because they really believe in our philosophy of what we're doing.
So a minute ago when we were talking about insurance, you said they don't know who we are or what we are. So who are you?
Well, a big part of our job as midwives trying to get third-party reimbursements from insurance companies is to continue to provide them with data and statistics about our outcome, because we can save insurance companies millions of dollars by prevention of unnecessary surgical birth, because our cesarean section rate is much lower than the hospital without compromising the health of the baby or the mom. And cesareans are very expensive. And I don't think this happens in Portland, but in some hospitals, physicians are even rewarded from their institution for having, for doing more C-sections because it can be more profitable for the hospital. So
is it not profitable for the insurance companies too, or no?
That's been my biggest question for years and years. And insurance companies are finally starting to listen to us because we've provided enough data to show how cost-saving, midwifery can be. Because, not only reducing cesareans, which is huge, but also increasing the health of the person who gave birth in that, she will probably, if she, breastfeeds the baby, there's, it's a healthier baby, and, we have less serious third-degree tears, less pelvic floor issues in the postpartum. So a lot of these things are measurable, especially the cesarean section rate being reduced. And so that's kind of why we're really working with insurance companies to have parity. We want to be paid the same for doing the same thing, getting a little baby out of a bigger human.
As you should.
And we actually do so much more than hospital-based providers are able to do. And some of those I've talked about, just spending quality time with people, it's taking time,
to get to know
listen,
them,
to get to know them. And it's hard to put a price tag on that. But what we do, our model is very expensive. For instance, if we go to do a home visit, we're going to drive all the way to their house, spend 60 to 90 minutes with them, and then drive, back to the birth center or to our next visit. So that is, maybe 3 hours of time, 2 hours of time. And that's expensive. It's a very expensive model. So we should be paid more for what we do and not less.
Yeah.
So hoping that happens very soon.
Yeah, I hope so. There seems to be a little bit of a confusion for some people around doula, midwife. What's the difference? Because they hear those sometimes interchangeably.
Yeah. Well, midwives love doulas. Put it that way. We're a good team to work. We can work together very, very well. We recommend that people that are choosing to have a birth anywhere, hospital, home, or birth center, hire a doula. A doula is a support person that is not responsible for the medical outcome or care of the birthing person. So doula is there to provide education, to help you during the earlier labor, when the midwife probably isn't involved in the care yet. Give you ideas on comfort measures, how to move your body, different positions to be in, support for the partner. So, they're really valuable as another support person. They also will, a big part of birth is what a person's thinking in their head. That's really the main thing, So if a person has they're really self-guided and they're in their head and they're like, I can do this, I'm made to do this, my body's so strong, I'm so capable, it's almost here. If they've got that sort of the track going, awesome. But, birth is a big event. So maybe in their mind they're saying, I can't do this, or remembering a scary story they heard once, or all of a sudden thinking that's taking too long, or they don't like being the center of attention. So if they start thinking that way, having a doula right next to them saying some of the things that ideally they would be saying in order to make the birth go smoother for them, just having someone there saying, you've got this.
Yeah, almost like a coach.
Yeah, it's like a coach. You're doing this. You got this. And of course, midwives, we do a lot of that. But there is a point where we have to catch a baby or start an IV or, stop a hemorrhage. So we can't be the full emotional support for the person giving birth or their partner.
Yeah.
Yeah.
It's almost like the doula can really focus on the emotional support. And even if you do some of the emotional support as a midwife, you could focus on the physical aspect of getting a baby out of a body.
Yeah. And doulas are also doing a lot of advocacy and are now receiving third-party reimbursement through insurance companies. And Care Oregon is one of our big insurers here. They're paying for doula support, which is amazing because it can make a huge difference for the birthing person in any setting.
Of course.
To have that
probably
person.
better outcomes.
Better
having more
outcomes,
support.
again, reduced cesareans. Yeah. I just want to make sure that we get it on record that cesarean birth is necessary, It's just the overuse of surgery for birth that isn't necessary.
Yeah, I mean, some people will need to birth that way.
Absolutely. It's life-saving. And in places in the world where there isn't a cesarean available, more babies die and some women die too.
You were just talking about mortality rates, and I wanted to talk about people of color, specifically Black women that have higher mortality rates than white women. Can you speak to that and midwifery and how it's different?
Yeah, we're just starting to get more evidence that place of birth can make a difference for people of color. When people birth in a birthing center, especially if they birth with people that look like them, the mortality rate is lower than when they birth in the hospital, and that's incredible.
It's huge.
That's really, really huge. It's really, really important moving forward that we make birth centers affordable for all people, and that there are, Black midwives and Hispanic midwives and, midwives for everybody.
Yeah.
And then let's measure and let's see what those numbers look like. And I think it can make a really big difference.
Yeah. Lastly, is there any practice or wisdom for people either before, during, or after birth? Is there any practices or any wisdom that you could think of that you would like to share that maybe we haven't covered?
Yeah, that's such
a
big question. I really want people to move in their pregnancy. We talked a little bit about, being sedentary during life, for being a human can cause a lot of illnesses, and not being active in pregnancy makes the birth a lot harder. They can hike, they can dance, they can, do yoga, go for walks, but just keep their bodies moving. It's really hard to ask a body to all of a sudden, get into positions and give birth when it's been still. We have time to spend with people, so we'll talk about nutrition. I loved learning from one of your former guests that beans will reduce adrenaline.
Amazing.
And I thought of that because after, if I have a long birth, I just want a burrito. So that makes sense. But we have the ability, because we spend so much time with people, to talk about nutrition. And we want them to, eat a rainbow of foods and eat a lot of protein and some healthy fats. So we talk to them about nutrition at the beginning, and then we talk to them about it all throughout their care. And then in postpartum, we want them to continue to nourish so that they can produce enough milk if they choose to breastfeed. So movement, nutrition, and, it's hard to ask people to have a spiritual practice, but I ask them to have quiet time, to turn off their phones and their screens sometime and just pause. You need oxytocin to give birth. And if we're speeding around all the time, it's just hard to get the right hormonal, soup going. And that oxytocin is from pausing and from connecting with people and from getting into nature and lovemaking and, just having space to just, feel love, and so
Yeah, I wanted to add, like, oxytocin's the love hormone
it
for
is.
anybody listening.
Yeah, it's the
that
love
doesn't-
hormone, and we don't have the ability to use a drug, a hormonal mimic drug called Pitocin. We can't put that in someone's IV in the birthing center, but it mimics oxytocin, that drug Pitocin. So we rely on people to make their own oxytocin. And again, it's hard to make oxytocin if you're feeling stressed or have cortisol. They don't get along with each other.
I remember one of the best pieces of advice that somebody gave me during my whole birthing. There was a lot of good pieces of advice, but one of the best ones was, what got the baby in there is going to get the baby out
Exactly.
there. And I was like, wow, okay.
Yeah, and that's
Point taken.
I just brought up Ina May Gaskin, the author of Spiritual Midwifery, and I think that's one of her sayings, is that it takes the same energy, and it kind of takes the same environment, too. So, that's why if you have a hospital birth, sometimes they have to use Pitocin because you're in an environment that's not conducive to, you don't birth as well in captivity, if you call the hospital captive, but with a lot of strangers coming and going and, maybe bright lights and a lot of machines, being in the elements that you could have at home or in the birth center where it's darker, it's private, it's quiet, you're in the birth center, Alma, that I opened, all of the birth rooms were designed to bring the oxytocin up.
That's beautiful.
Yeah. And so during pregnancy, just spending time whipping up that oxytocin. I mean, it's a good advice because it's fun.
Yeah, it is fun.
All the things that make oxytocin are fun things.
Yeah,
Yeah.
they are. Can you tell us just like one or two wild stories from all these years of birthing?
Good
babies?
question. I did tell you that birth is challenging, which really helps my spirituality, but birth is also great opportunity for humor and for, fun adventures. Getting together with a group of midwives will just be our stories overlapping each other. Many years ago, I was at a birth and we looked out the window and their barn was on fire. And this tells about kind of the mind-body connection between birth, because she was about 6 centimeters and having good, strong contractions. When she knew that their barn was on fire, her labor stopped because she got adrenaline. And then we all went out and, helped the cows and everything out of the barn. And, once that was all done, we were sitting in her living room and we were all sooty and she didn't have any labor anymore. So she had to take a shower and relax and eat. And then she gave birth. But yeah. Those are, a couple of kind of dramatic birth stories, but there's always humor in a birth too.
Do you feel what you do is spiritual in many ways?
I think it really depends on the midwife, but for me it's profoundly spiritual. And I think maybe that's why I've continued to do it, besides the element of awe. Being a kid born to middle upper class people in Minnesota and, never having experienced war. And, I had to go out of my way to find a career where I have had a lot of hardship and have had to develop, my own spiritual practices in order to continue to show up and to stay in it. And, those of us that are parents know you get your kid and it's not, for most people, they don't then decide if they're going to parent or not. They've decided to have a child, they've got a kid, you're kind of in it, Some days you don't want to, and I took kind of the same commitment to midwifery. It wasn't like I'm going to give up when it's hard, because it is hard a lot. And it would be pretty impossible to do the work that I do without having some sort of ability to ground myself spiritually. And if I get overly busy and rushed, I can really tell that I haven't been tending that. I haven't, been doing the practices that restore me and make me able to be available to people.
Yeah. It's almost like you have to fill your cup first.
Yeah.
Yeah.
Fill my cup, put my oxygen mask on, all of those, because the work that we do is so important to people. They're going to remember.
Yeah,
They're going to remember the little things that you said, even if the little things you say aren't the most positive, so you have to really be on all the time. So even if
And integrity.
if I, measured someone's belly and then I started to think about my grocery list or something and I made a little frown or something, they would then think something was wrong, because you're so open when you're pregnant. You're just like wide open, raw, so you're that way so that you can fall in love with your baby. But it makes for people that are pretty sensitive.
Yeah, you have to be present.
To be present, you have to be sensitive, and just know that their antenna is up, because they're picking up the things that you say. And even if your mannerism...
Yeah, or don't say.
Or don't say. Or if you say something small like, oh, you're palpating their belly. Oh, this is a big baby. Then they might think it's too big. So staying on my spiritual game helps me most of the time, be able to
be
mindful of what I'm saying with people.
Yeah. Well, thank you, Laura. I'm so grateful that you came to share all this wisdom with us. I'm hopeful that this is going to touch so many different people.
Yeah. Well, thank you, Mira. I appreciate you.
I appreciate you too.
An excuse to get to sit and talk with you again, too.
If you enjoyed this conversation, please like, subscribe, and share with a friend. You can connect with Into Healing on TikTok and Instagram for more inspirational and behind-the-scenes content, and visit our website, intohealing.com, for transcripts and other goodies. Thank you for joining us.